All good sex starts with a conversation, and there will be different conversations to be had.
So how do you talk about sex and cancer? I'm Helen Addis, also known as the Titty Gritty on Instagram, and I'm joined by experts Richard and Sarah.
Hello, my name is Richard Simcock. I'm Chief Medical Officer at Macmillan Cancer Support, and I'm also a consultant oncologist treating women affected by breast cancer.
Hi, I'm Sarah Malindwa, Sexual Health Specialist Nurse and Lovehoney Health Expert.
So, something we need to discuss is libido, and I think libido is really difficult to talk about. How do you talk about that with your partner?
I think the earlier the better. Oftentimes we can be experiencing low libido, feel a bit shy or maybe not comfortable to speak, even with our partners. So if you pick a time where you're in a comfortable position, and I think using language like I and me, and they'll probably prefer you to sort of bring up the subject. When we think of the word intimacy, we think of sex and a sex drive, but there's so many things that fall under that umbrella. And I think even things like holding hands and cuddling and going on date nights, prioritizing those when you're experiencing a low libido is really important.
And just normalising that language, because libido is a very medical word.
Yeah.
And we know that people who are going through cancer treatment, one of the most common symptoms is fatigue. So you talk about you're tired. I'm so tired, I can't even think about sex. And that's a good tip for healthcare professionals as well. Healthcare professionals are sometimes hesitant to talk about sex, but they're very happy to talk about fatigue. So say, is fatigue impacting on you? How's that impacted on your sex life? So it's a way to normalise that language, de-sterilise it, make it a part of a conversation between a healthcare professional and a person affected by cancer, but also between two people.
Certainly my libido was definitely affected during my cancer treatment and afterwards. But it's that feeling of not wanting to bother the health professionals that have effectively kept you alive. It's almost, it feels like I shouldn't be worrying about the fact that my libido has been affected and maybe it will come back in a few years. Who should I go to? Who should patients go to get advice?
Well, you absolutely should be able to go to your healthcare team. And we do understand that there are some healthcare professionals who are less confident, less comfortable about that. One of the things we do at Macmillan is something called the Holistic Needs Assessment, where people fill in a long checklist of questions about things that bother and affect them. And in that, there are questions about sex life, which shows a person affected by cancer they've got permission to raise that with their healthcare professional. And the world I'm looking forward to is the world where people affected by cancer feel completely unafraid to ask that question, and all healthcare professionals make it a routine part of their assessment to ask the question. So everybody knows it's part of normal business to have that conversation. And it is not for the medical team to define what a person's normal should be, but it is for the medical team to allow that person to achieve the normal that they want. And different people will have different priorities. And if a person prioritises their sexual wellness, they absolutely should be able to share that with their team and get some good answers.
And what about from a partner's point of view? I know that my husband definitely found it difficult broaching any kind of like intimacy with me, and he was almost like treating me with
like a delicate flower that might break.
Exactly.
Well, it's extraordinary, isn't it? People can share the most intimate moments together and do the most intimate things with each other, and then not be able to talk about
it afterwards, yeah.
So my advice often if I'm seeing a patient on their own and they say, well, I'm really not sure how I'm going to talk to my partner about this, I'd say, well, we've had a conversation today about your sexual difficulties. When you go home today, hopefully your partner will ask you about your consultation. How did it go? Say, well, Richard, you kept asking me about my sex life, and he was asking about whether I orgasm, and he was asking about when my vagina's dry, and should I be using lube, and what lube? And your partner will say, and what did you say? Yeah. And I said, well, I said this and I said that, and it's a very neutral way to open that conversation without drama or intrigue or worry.
Yeah, that's so true. This one is so common and I can really relate to it. How do you still feel sexy even when you're tired or your body's changed, maybe you've had surgery? You know, I know for myself, learning to love my body again after being ravaged by chemo and having quite major surgery, you don't recognise yourself anymore.
So I think it's about changing our mindset. Sexiness and what we see as attractive goes far beyond the physical. You have to remember that your partner's with you not just for your physical looks. Our looks are the icing and not the cake. There's so much more to us than our physical, and so I think when you place the emphasis on the little things in life that can make us feel good about ourselves, I think just remembering that can help you to sort of bring your sexy back. And just remember that I'm more than just, you know, if I've had a mastectomy, I'm more than just my breasts. I'm more than all these things.
That feels very true to me. And I think that when couples have been together for a long time, they'll often know how to please themselves and how to please each other, and their sex lives will have a pattern to them. And then something like cancer comes along, and it's like a record that you love that's got scratched, and you play it and it doesn't play the way you remember it. So you do have to rediscover it. I think there's something about self-love as well, though, because if you're not in a relationship and you're wanting to start dating again and you don't understand how your body responds sexually, and your body has changed and you're upset or worried about, maybe you've lost a breast and the breast was an important part of your sex life. Maybe you've got a stoma and sex in the missionary position is practically difficult. So understanding your own body and what pleasures you and makes you happy is going to be a really important first step before you move into any form of sexual relationship, either with a long-standing partner or if you're not in a relationship. In my practice, I prescribe drugs for breast cancer, which very commonly cause vaginal dryness. So I will say it's likely when you have sex that you'll need some lubrication. So I'd suggest you buy some lube, so that if they then have sex and there's unexpected dryness, you say, well, we knew that. It's not a shock, both partners were prepared for it.
Now, another question I've got here is, should people tell their sexual partner about HPV?
Yes, HPV, the human papillomavirus, is a very, very infectious virus. Most adults will have been infected by it by the time they're in their late teens. Pretty much everyone has been infected by HPV.
Right?
Yeah. What's interesting about HPV is that whilst almost everyone gets HPV, most adults will clear it. Their immune systems will get rid of it. But in some people, HPV will hang around. And if it hangs around in the cervix or in the anus or in the throat, it can lead to cancers in all of those areas. What we'll often see in patients is a sense of upset and worry that, oh, I caught this. Is this a sexually transmitted disease? And in turn, if I've got an HPV-related cancer, could I in turn pass that on to my partner? You will not pass HPV on to your partner because they will already have had it. And the presence of an HPV-related cancer should definitely, absolutely not affect your sexual relations with your partner.
And I get that question a lot in clinic. Somebody will come in and say, my partner's just been diagnosed with HPV. Can I have a test? What can I do? Having the virus in itself, it's not something that you have to share because it's not going to do anything. So there's no harm sharing it if you feel like it.
If you are going through chemotherapy or a drug for cancer, can you still have intercourse?
Yeah, absolutely.
Could it be unprotected?
So a couple of issues there. First of all, sex is not always at the top of people's minds when they're going through chemotherapy.
Funny that.
But it is safe. There are some very specific chemotherapies which can produce trace elements of chemotherapy in secretions. So if you are having any form of penetrative sex, you're usually recommended to use a condom. That's not all chemotherapies, it's not all cancer drugs. Your chemotherapy nursing team will be able to tell you.
Oh, this is one I get asked a lot. Does your sex drive return after chemo?
It does.
Asking for a friend.
It does, but again, it's like asking how long is a piece of string.
I think of sex drive, it's not like a light switch, it's not on and off, it's more like that dashboard you see on a jumbo jet. There's all kinds of dials and whistles. It's your energy levels, it's the relationship you've had with your partner, it's what else is going on in life. Are you anxious? Are you worried? I don't think that life ever goes back to being exactly the same. Experience changes us, whether we go on holidays, the jobs we've had, or the people we've known, and the diseases. When you go through a cancer experience, it will alter your view of the world, and part of your view of the world will be about how you feel about yourself. But hopefully you reach a new normal which has pleasure, and part of that pleasure is sexual health.
Is there something that you can do practically wise that could reignite the fire?
It's a slow build back to normal.
It depends on what side effects you're experiencing and then how, what's available. But there's loads of health products. I know Lovehoney have a whole range of health products that are safe to use for a variety of different difficulties that can be remedied through them. I always say sex is psychological as well as physical. That's why it's so important to have these conversations, because the less you talk about it, the more things build up. We know that it can affect your mental health, of course, so opening up about it is always a positive thing.
The male erection is probably the most obvious anatomical, physical sign of desire, of libido and physical function.
Well, you can't fake it.
You cannot fake it. And it's very dramatically affected. So for example, in prostate cancer, the majority of our prostate cancer treatments involve deprivation of the male hormone, and as a consequence of that treatment, most men will lose the ability to get an erection, and that can be devastating for them. Amongst our Macmillan resources, we've got one of our storytellers, Elvin, tells a very powerful story about how that impacted his life. So anything that can help someone restore function, the ability to know that it's possible and available to them can be hugely important in restoring libido and sense of self-esteem.
But what about the impact on mental health?
I think a lot of a person's experience of cancer is marked by loss of a body part through surgery, a loss of friendship groups through the things that go on after a cancer experience, and a loss of libido or sexual life is going to impact on yourself. You may feel less of the person that you were before. And it's an overused phrase, so I apologise for it, but it's about building a new normal. It's about where am I now and what do I do with this life I have at this point that I have. But there is acceptance required to do that.
And if you really are struggling, you know, there's therapy, there's sex therapy, there's ways in which you can combat them. And I think it's also amazing that we live in a digital age now. Before, it would be harder to find like-minded people going through the same journey, whereas now there's so many support groups, there's so many people in the public eye who talk about their experiences. And I think from my experience working with cancer patients, this is what really helps them getting through.
That's one of the big things actually I think I've taken away from this conversation today is actually the more we talk, the more it feels normal, I suppose. Something that happens to me quite often is, and I don't know with you guys, when you log onto Facebook and it shows you a picture of this is you 7 years ago, and I look at that picture and in my head I know that that's BC, before cancer, and I look at that person and I almost don't recognise her, and I look at her and I think, how do I get back to that? And it's a journey. It's a journey to realise that actually that's old Helen, and that's not me anymore. And it's that acceptance, and the more that we talk and share, and especially within the community, and I think the more it helps, really.
I think we as a charity, information charity, have responsibilities to make sure information's up to date. It's about making sure that information is available to all people all the time.
To all communities.
To all communities,
yeah,
and it reflects the sex lives people have, so they can have the information that they need and can find it in the places they go looking. So I think talking about this is really important, and when I reflect on the Macmillan and Lovehoney campaign and the videos we've put out about people talking very frankly and honestly about some extraordinary sexual difficulties, the response to those videos has been absolutely amazing, and people echoing, feeling seen, feeling supported, and offering support to each other. So the more that we can have these conversations, the more that we can normalise them, destigmatise them, I think the more we'll help each other.
Okay, well, thank you both so much. So to summarise, what is our biggest take home, would you say, today?
Well, for me, I think it's that probably all good sex starts with a conversation, and there will be different conversations to be had. You may need to have a conversation with your healthcare professional team about how you're being affected. There may be physical things that you need addressing, problems you want to talk about.
I think my takeaway from this is that recovery and going through cancer treatment doesn't have to mean that you lose your sexiness. And I think it's important, and how we were discussing before, that mindset in changing what we define as sexiness. What we need to remember is that our partners don't just see us as physical beings, we are much more than that. And remembering that sexiness is in the inside as well as it is on the outside. And knowing that if you are struggling, there are ways to mitigate symptoms, and there are tools that are available that you can use to sort of help you have a better sexual experience.
Thank you so much. Thank you both so much. So I don't know about you, but I feel totally inspired, informed, maybe a little bit sexier on the inside, who knows. But of course, we'd love to hear from you as well. So underneath this video, please do send your comments, your questions, and don't forget to like and subscribe.